Yes, sir. Now we can start.
Yeah. Okay. Good evening. So today we'll discuss about important topic regarding the clinical social case Proforma. So actually, before we go to actual thing, I wanted to just tell what is the importance of taking the clinical social case Proforma. Why it is important to discuss. Okay. So if you what is the main difference between clinical social case history taking or when we take other subjects like pediatrics, medicine, surgery and all? What is the main difference we usually see? So when you see in other subjects, we usually mainly think about chief complaints, a little bit about basic details, then we go about the chief complaint HOPA and all. Then we go for the clinical examination and we arrive at some differential diagnosis. Then we'll go for the investigations. Then we arrive at the final diagnosis. Right. But here we all know that whenever we talk about communicable diseases, especially, or even for that matter, non-communicable diseases, we always try to look for the causation. Okay. So when we try to look for the causation, especially in communicable diseases, we will be looking at the epidemiological triad. So we all know that epidemiological triad, it consists of agent, host, and environment. So when we only thinking about treating one patient, okay, in that scenario, we what we deal with other subjects like pediatrics and all, we dealing with one person may be enough. But when we're talking about community medicine, our main aim is not to only treat the patient. Okay, our main goal is to treat the disease what is already occurred and prevent the disease spreading to others. Okay, if it is communicable disease, and also prevention of the complications also. Okay, if at all, if any non-communicable disease, if it is there, we have to talk about the non-complications. We have to prevent the complications also. Okay, so in that process, we by just giving only talking about present illness is not only important. So we have to look for the what are the causative factors or which are the factors contributing for this person to get this disease. Okay, for example, if we take TB, so there are so many problems. Not only the what you call tuberculosis bacilli or Mycobacterium tuberculosis bacilli, there are other so many social factors and economic factors which are contributing for that person to get the disease. Correct. So in that way, we have to deal with the so many environmental factors. For example, overcrowding, low socioeconomic status, people living in endemic country as in India, and lack of health facilities, are so many factors will affect the disease progress in a community. So when we talk about a disease in community medicine, we always have to think about the other factors, not only about the agent and host. We have to think about the environment also. In environment, we are having so many things. Okay, that we'll discuss. Apart from that, economic factors. So socioeconomic factors, that why it is important, because we, for example, if we take last when we discussed TB, so TB continuation of treatment for 6 months is very important. Once you start the treatment, they have to continue the treatment for 6 months. So whether their socioeconomic status will make them to continue with that or not. So based on socioeconomic status also, government is providing some benefits. Okay, so all this will help us to know the patient better, is environment better, and its outcome we can little bit predict little bit. Okay, because based on his socioeconomic status and based on environmental factors, we can predict his outcome. Okay, that is the main reason why we always try to take the, not only along with the history, we try to take the uh, other parts of the history, like what you call socio-economic factors and environmental factors. Okay, so today we'll discuss. I'll just showing a one Proforma what we usually used to use. Okay, it's not, doesn't mean that almost, it's almost like a almost combination of almost different colleges things. I actually acknowledge, I want to acknowledge my seniors and my juniors for contribution for this. It's not, it happened only over a period of 3 to 4 years. Okay, but just I wanted to discuss few things, important points only, which is already I'm not going to discuss. So what is there only we'll discuss. So when it comes to clinical social case, okay, so in any clinical social case or any case there we'll be having three parts. Okay, like one is history taking. Okay, one is basic demographic details, then history taking, examination, and diagnosis. Okay, so like that only we are having the same proforma here, but here a little bit detail will take in the basic demographic details. That is in clinical social case proforma. We'll take little bit details. We go about name, age. I'm not going in detail about why you have to take name, age, and all. I'm not going because we don't read in third term and all. So I'm not going in detail about it. So what is extra only in this clinical social case proforma, I'm going to tell. So we are going to take the name,
Excuse
age.
me, sir. Sorry to interrupt, but
Yeah.
could you please zoom in a bit, sir? On the YouTube, it looks very small.
Small, huh? Okay, well, I'll go to read mode. 1 minute.
Yes.
I'll go to read mode. Yeah, now visible. It's better now.
It's visible, sir, now. Thank you, sir.
Yeah, okay. So in this clinical social case proforma, so same basic demographic details we will try to collect. That is name, age, sex. So if they are talking about father or husband, we can take the name of the other. Complete address. So here what we try to do is taking a complete address. So we may just write, for example, in Bangalore, we write just Kingeri. That is actually not the correct way to write the complete address. So you might have you may be knowing the now in these COVID times, the having the complete address details about the a person in this scenario is very important to do contact tracing and other things. Correct. So we have to take the complete address.
ಅಷ್ಟು ತ ಮಾಡಿದ್ರೆ ಇನ್ನೇನಾಗತ್ತೆ ನೋಡ್ಕೊಂತ ತೂತ ಮಾಡ್ಬೇಕು.
Okay, hello. Yeah, and we have to see for the which type of family, whether it is nuclear family, joint family, three generation family, and some people will also ask for the broken family or problem family. What is broken family means? Their parents are not staying together. A problem family means husband is means father is a drunkard, or maybe having drug addicts. Such problem. These are problem families. Okay, so usually for your level we may talk about nuclear family, joint family, three generation family. Okay, next, annual income of the family. So when you talk about annual income of the family, you have to take the annual income of the whole family. If there are more than 2-3 people are working in a family, so you take the all their family income and calculate. Okay, so we usually prefer to go for the, instead of annual income, go for the monthly income. So annual income is not correct. Sometimes when you go for the calculation, it will be a little bit difficult. So always go for the total monthly income of the family and number of family members. So in the family, if there are 4 people or 5 people, you write it. So it will help us to calculate the per capita income. So per capita income also make it for the month. Okay, so per capita income per month. So how do you calculate per capita income? That is total annual income of the family divided by number of family members. So when we try to take the number of family members, usually some people will say don't include an infant for the calculation of the number of family members. Okay, so this is a little bit what you say controversial, I may say, because so we all know that if any newborn baby has been born in the family, definitely there will be too much of expense also. Okay, so some people may say no need to include, some people may say include, but in textbook and I'll mention that it's no need to include the infant less than 1 year. Okay, so you can go by that. Then so you can calculate socioeconomic status. So when it comes to socioeconomic status, we usually use the 2 types of scales. Okay, one is modified Kupusame classification, another one is modified BG Prasad classification. So modified other one is Parikh method. Parikh method is having so many components, which is always difficult to do at this level nowadays. Okay, so it is mainly used for the rural population, whereas modified BG Prasad classification can be used for the urban population, and even your modified Kupusame classification, it can be used for the urban and rural areas. Both it can be used. And what is in BG Prasad classification, they use only the income as a criteria to categorize them as the different families, like upper class, middle class, and all. Okay, whereas it comes to modified Kupusame classification, it includes 3 components. That is education, occupation, and income of the family. Here, when we talk about education and occupation, here they talk about the education and occupation of the head of the family. Okay, so head of the family only they will take for the to categorize them into categories of the socioeconomic status, like upper middle, lower upper, like that. Okay, so nowadays we can also ask them whether they're having below poverty line. If they're below poverty line people, they're having any BPL card or not. Like you can ask them, and you can write it about like that also, above poverty line or below poverty line. Okay, so next one what we're having is health services near their house. What health services are available? For say, for example, within 1 kilometer radius, or say within half-kilometer radius, what are the health services available for them? Okay, whether they are having Anganwadi at their house, nearby places, or they're having sub centers or primary health centers or taluk hospital, private, any healthcare services there. Why it is important? Because in case of any emergency, where they can go, we should know how far it is from their house. We should know. Okay, so this will help us to deal with the emergency services. Okay, apart from that, social institutions, any institutions like school, any post office, bank, transport, police station, and all are available, because these are all what we written is maybe for rural area it may be very much helpful. Okay, so this will help us to know about the uh, progress of that community as a whole. Okay, so it will help us to know what are the health services available at that area. Also, what emergency services we can get available can be given for that person in that case of emergency. Okay, and next one is we take the details of the family. When you take the details of the family, it's better to write a tabular format, what I'm sharing on the screen. So you can write the who is the head of the family. So name of the family members you can write, relationship of the head of the family, age, gender, literacy status, occupation, income, and remark. Okay, so before explaining this, I just wanted to ask who can be the head of the family. So definition says if head of the family is a one person who is earning for the family and who takes the maximum decisions of the family. So maximum decisions of the family. Some nowadays in nuclear family we may be having the, for example, both father and son may be earning. Okay, okay. Sometimes father son may be earning more than the father. Then who will be the head of the family? Some people may ask the question. Okay, the here not only about the who is earning more, but who is taking the important family decisions, like how much money should be spent for the family, like family expenses, monthly expenses, how much money should be saved, how much money should be utilized for education. So those things who will take the decisions, that person will become the head of the family. And I wanted to stress here, head of the family, even though India is patriarchal society, so most of the time we may see head of the family is a male person. Okay, it doesn't mean that females will not be head of the family. Okay, so don't try to attach the gender to the head of the family. So in some places we have seen where mother may be there, or maybe husband might have expired, mother may be there, so she may be not earning anything. Okay, but still she will be taking the maximum decisions of the family. In that time she may become the head of the family. Okay, some scenarios may occur. So what we're trying to tell in textbook, it may not be always same in the field level. Correct. So you have to analyze the situation and give the status of the head of the family to that person based on the income and the who takes the maximum decisions of the family. Okay, so you can write the, for example, Mr. X. What is the relation of the, you can write head of the family. His age you can write 35, 40, whatever, gender, literacy, till what age, what's the class he has studied, like 10th standard, 12th, +2, or degree, professional degree has studied. So whatever he has done, occupation, you can write. So income, what is the income per month he is earning or she is earning, you can write. Then remark, for example, if that person is having any disease like long-standing history, like diabetes, hypertension, okay, asthma, you can write in the remark column. And if he has undergone any recent surgeries for any ailments, you can write there in the remark column. Same way, Mrs. X. So what is the relation to the family? Like wife of the head of the family. Age you can write, gender you can write, related status, occupation, income. If they're not earning, you can write nil income. If their occupation is housemaker or homemaker, you can write homemaker. Remark, same. If they're having any disease, you can write. Okay. So when you're writing the remark column, if you're dealing with any under 5 children, you try to write their immunization status. Okay, you write the immunization status. And if you're dealing with any children less than 2 years, okay, if you're dealing with any children less than 2 years, better to write the age in the months. Okay, for example, if they're dealing with a child with 13 months, you write age of the child as 13 months, 13M. Okay, so it should be specific in especially less than 2 years child, you have to write the age in the months. Don't write, because why it is important, because usually we write, if the age is 12, 13 months, we may write 2 years or we may write 1 year. So there is so much of changes will be happening for that child. So that's why we should write the month in the for the less than 5-year child, especially less than 2-year child. Okay, so this is for the family details. And if there anybody is having any doubts, you can put a message in a chat box so that we can discuss there itself. Okay, so I'll go to next part. Okay, okay, so after this, we can, after writing the family details, we can go for the chief complaints. Okay, so here I'm not going to in detail about you people know that how to take the history and all this part. Okay, this part I'm not going in detail. Okay, you write the chief complaints, whether they're having cough, fever, whatever is there, you write. The history of presenting illness, you write. Then you write the family history, then epidemiological history. So epidemiological history. So you try to analyze what are the agent factors are contributing to this patient. Okay, what are the worst components are contributing for this person to get this disease. Okay, in this COVID times, you all know about the importance of contact tracing. Okay, if any person has come in contact with the patient, so we're going back is the timeline and trying to find out who has got a disease, whom we got contacted. So we are doing that. No, same if, for example, in communication for TB also, so we may have to go for the contact tracing. Okay, so and whether he has got any history of exposure to a positive person. So this all will help us to do the help us to know about how he contracted the disease. Okay, whether it's a new disease, whether it has got as a new disease, or somebody has contributed for him to get the disease or how to get the disease. So this will help us to know the origin of the disease. Okay, then past history, whether is there any same similar episodes happened or not. Okay, then about the personal history, you all know that appetite, diet, sleep pattern, bowel, bladder, drug allergy. Okay, if they're having any smoking habits and all, chewing, alcohol, substance abuse, if anything is there, you can mention. Then immunization status. If you're dealing with a child, as I told, if you're dealing with a child as less than 5 years, you have to try to write the detailed history of the immunization. Okay, so sometimes we write immunized as per the age. Child has been immunized according to age. So what it means? Okay, so you should know. For example, you're dealing with a child who is 9-month-old. The child should have taken. If you have to ask for the child parent to show the immunization card, if they not have the immunization card at that point of time, so you can ask some cross questions to verify. Okay, BC definitely you can see for the BCG scar. OPV and DPT are pentavalent and all. You can check, ask. You can ask some questions like, what are the vaccines you are given? Like, instead of asking, did you give the vaccine at this month, or did you give the vaccine at 1.5 months? Did you give the vaccine at 2.5 months? Did you give the vaccine? Instead of that, did you give vaccine any vaccines? You can ask like that. Okay, instead of asking leading questions, you can ask the months. Okay, then child is 9-month-old, means child is supposed to take the MR vaccine. Okay, so if any vaccine has been given, so if you know this, what is site of MR vaccine, usually they give MR vaccine on the right deltoid. So you can ask, if mother says yes, vaccination has been given, so you can ask, where did they give vaccination? So if the mother usually remembers where they're given, she may say they're given on the right hand side at left hand side and all. So based on that, you can cross verify whether she has whether they've given the vaccination or not. Okay, so before concluding whether they have taken the vaccination as per the age, so you should have to look for their, you have to cross verify also. Okay, ask for the immunization card. If it is there, it is well and good. If it is not there, you ask some cross questions to verify what they're telling is correct or not. Okay, so this is immunization history. Okay, next one is personal hygiene status. Okay, this one you can write, you can put it as a table, or you can put it as a single statement also. For example, if everything is good, like if they're well groomed and all, then no need to write entire thing, all these things table. If they're not groomed only, then you can write in detail. Okay, like hair, teeth, bathing, whether they're having using clothes, proper clothes or not. Okay, all these things you can ask. Okay, then you can comment on their personal hygiene status, whether the hygiene is good, fair or poor. Okay, and if you're dealing with women, okay, if you're dealing with women, then you have to ask the menstrual history, and if she's married, and then you have to ask the obstetric history. Okay, in menstrual history, you have to ask menarche, age at marriage, all those things you have to ask. Okay, then if she is pregnant, then you have to ask for the LMP and expected ED, and what is the obstetric score, you can ask for and you can write. Okay, so this one is important. Next one is diet history. Even though in other like pediatrics medicine and all, we take for the diet history only like vegetarian, mixed and all, but here we have to take little bit extra. Okay, usually we go for the 24-hour recall method. What is 24-hour recall method? So what they eaten one day before. Okay, usually we say, if they are, for example, patient is admitted 2 days back to the hospital, you have gone today to take the case. So if you ask the patient to what diet history they've taken, so they may tell what they've taken in the hospital itself. So better instead of that, you can ask them to before getting admitted what they used to take. And okay, so in diet history, based on the person occupation, okay, like moderate worker, sedentary worker, moderate worker, heavy worker, or male or female, we will decide how much kilocalories required for that patient. Okay, how much kilocalories required for that patient. Then you have to ask for them to tell what they've eaten for the morning breakfast, then snacks, then dinner, lunch, then evening snacks, and what they've eaten for the dinner. Then you can calculate the kilocalories taken and protein taken in the 24-hour recall method. Then you can calculate whether the amount taken by 24 recall method is sufficient or excess or deficiency is there. How much deficiency is there? If you can write, for example, expected is say 2300 kilocalories for a moderate worker. So 2300 kilocalories, yes, is supposed to be taken. That patient may be taken around 2100. So if you calculate expected minus consumed, it is around 200 kilocalorie deficiency is there. Sometimes patient may be taking extra. Okay, patient may be taking extra. In that scenario, what you have to do? You have to write excess, how much excess they're taking. Okay, yeah. So till now, any doubts? Excess injections, or what are the other methods of diet charting? Okay, so what are other methods of diet charting? So other methods, apart from 24-hour recall method, we are having consumption unit method. Okay, for whole family, we calculate consumption unit based on the requirement of the for family. Okay, that is nowadays it's not for your level, UG level, it's not important. Okay, and also we usually use the other method. For example, how much raw material they're taking for the how much raw material they consume for a week or for a month, we can calculate. Okay, then one more method is dry raw food material. Okay, because what we're asking here is if you see the calorie calculation, what we are doing for the cooked food. Okay, so if you're using cooked food, so you have to use the 24 recall method. And if you're doing any other method like ration method or weighing the raw materials, then you have to go for the uncooked food kilocalories. Okay, for that you have to go for the National Institute of Nutrition, Hyderabad website. They're given the some list. Okay, but what I say, you go for the 24 recall method, and if you go for the NIN website, almost all the varieties of food, even South Indian food, North Indian food. Okay, even in South India we're having different food, like in Andhra there is different pattern, Tamil Nadu is different pattern, everything almost they've done. Okay, even in North India, what the style of they're having, chapati, roti, paneer, all those things they've calculated, and approximate, these are approximate value. Okay, we cannot say this is exact value, but we can approximately we can take. Is 24 recommended is best method accurate? No, is 24-hour recommended is not best method. Okay, why? Because for example, you take one day before there is a festival, definitely I might have taken so many things extra. Okay, so usually we say 24 recall method, it's a little bit feasibility is a little bit easy for, to take the history. Okay, that's why we are taking 24 recall method, but it's not accurate method. Okay, so type of family, explain definition and powder soap. Okay, type of family. Okay, okay, so 24 in type of family we are having mainly three types of family. One is nuclear family, giant family, and three generation family. What is nuclear family? So nuclear family means where father, mother, and their children will be there. That's all. It's a nuclear family. Whereas in giant family, along with the this family, siblings of the father, okay, they also may live in the same family. What are the main advantage of giant family and nuclear family? In nuclear family, we'll give more importance to privacy. Okay, but in giant family, we'll give not much importance to the privacy. Okay, there will be in nuclear family, there won't be much role for the sharing of the work, because of less number of people. Whereas in giant family, there will be too many people, they will share the work. Okay, but when it comes to income, in pooling of income will be happening at the giant family. Whereas in nuclear family, only two people, if the only one person is earning, it's only one person's income. Okay, but there are some problems, disadvantages, advantages in both the types. Okay, so whatever is important, there are some important advantages in giant family, like especially child rearing. Child rearing in nowadays is very difficult in nuclear family. For example, both the mother and father are working people. If the newborn baby is there, for 6 months they can take care. After 6 months, they have to go for the work. In that time, they may have to look for the creatures. They may look for the some person to look after the baby and all. Okay, this will hamper the, and in that case they may not give the adequate breastfeeding also. Okay, these are some disadvantages. When it comes to joint family, there will be so many people. For grandfather, grandmother will be there, and aunts, uncles will be there to look after the babies. Okay, these are some advantages and disadvantages. Okay, then some in food frequency, what do we ask? In food frequency, we can ask how many times they're eating. Okay, so like what we write in the diet history, when we're writing breakfast, what they're eating. Then if they're having any snacks in between before the lunch, then we can ask for a lunch. After lunch, they're taking any snacks like tea, coffee, anything they're eating in the evening. Then we can ask for the dinner. Okay, this much we can ask. Then betel nut powder, soap, some pan is eating. Okay, so some people are eating betel nut powder and pan. Okay, if they're eating only pan and all, it's not much. You have to ask about it, but it is not. If they're using any tobacco product along with that, then it is important, very important, because if they're chewing betel nut and pan, definitely their teeth and all color discoloration will happen. So that we can comment. Okay, some people, what they do along with the betel nut, they will use tobacco powder they will use to chew. That is a important. If you see in most of the rural India, more than cigarettes, in India actually chewable tobacco is one of the biggest problem, rather than this one, what you call smoking. Okay, so you can ask for it. It's important to note down the even if they're taking betel nut and all. So we only ask for the frequency, but in 24 recall we also specify the content. Actually, there's a difference in FFQ. I'm not much aware about it. Okay, so I'll once if I get into, I'll explain. Okay, I'm not sure about FFQ, but in 24 recall method, we'll write the quantity, how much they're taking, especially in terms of what you say, how much they're eating, 2 idlis, how much kilocalories, and how much protein is taken. That much only we write in 24 recall method. Okay. So if any doubt, if no doubt, we'll go to environmental history. Yeah. So I'll go to environmental history. So here it is very, very important. Here I want to stress upon some few things which is important in community medicine perspective. Okay. So here I'm not divided into two things. Usually we divide into environmental history into two types. One is micro environmental history and macro environmental history. So what is macro environmental history means? Before you entering, for example, you gone to a field to take the case. Okay, in that time you entering the house. Before you entering the house, you look the surroundings. You look the surroundings, like any drainage, open drainage is there, like where is any dumping place for the any dumping area is there, waste for the waste collection is happening near the their house, any breeding place for the mosquitoes and house flies are there, rodents are there. Okay, then you look for any domestic animals are there, or any domesticated shed is there for the cows and all. Okay, you look for that. That is comes under macro environment. When you enter into the house, it becomes micro. Okay, so that is the one way of dealing with that. So here, since we are dealing with the other part, so we'll go in this order only. So whenever you're entering a house, you look for the what type of house it is. Why it is important to know whether it's pakka or kacha house? Why it is important for us? Why it is important? Because so it is indirectly tells us about their socioeconomic status. Okay, so it will indirectly tells us about the socioeconomic status and whether it is attached or separate. So why it is attached or separate, we have to look. So if you see in olden times and all, both the houses, if the two houses are neighbor houses are there, both the houses will be sharing the same common wall. In such scenario, what will happen? There will be less air circulation, and there will be less, I mean to say, less cross ventilation and less lighting will be there inside the house. Okay, that's why we have to ask about it. Then about type of floor. So floor, why it is important for us to know the type of floor, whether it is tiled, granite, or cement, or a dark soil, or mud. For example, if you nowadays you're not seeing much cases. If you see in olden movies and all, maybe in people will be living in hut. Okay, even in some tribal hamlets, still people will be living in huts where their floor will be made up of mud, or they usually use cow dung to smear the floor. Okay, there won't be any cement. So what is the importance of that? So if imagine a child is there inside, less than 2-year-old child is there in that house. For example, child is playing, when the something is given to the child to eat. Okay, what happens? Child while eating, something has fallen down, chocolate has fallen down. What is the immediate response of the child? To take the chocolate from the ground without even washing it. Correct. So imagine that is a mud floor. So there will be so much of chance for the contamination on, so that there will be increased chance for the acute respiratory tract infections and diarrheal episode in that child. Okay, that's why we have to look for it. And also, if you see in olden days and all, we used to see more number of rheumatic heart diseases cases or rheumatic fever cases. Okay, one of the contributing factors, streptococcal cough, streptococcal post-streptococcal sequelitis. So where most of the people used to where floor was made up of cow dung and all. Okay, so such cases used to happen. Okay, so whatever history we take in this clinical social case, not only clinical social case, any history you take for that matter in any subject, pediatrics, surgery, or community medicine and all, there will be a reason. Okay, you should know the reason before asking the question. It's not only for the sake of asking the question you're supposed to ask. No, it's not like that. You should know the reason why you have to ask that question, and you should try to correlate with this person's ailment. Okay, next one is wall. For a wall, we have to look for whether it is wall has been plastered or whether the wall is just open like that, whether the walls are made up of bricks or walls are made up of like coconut leaves and all in huts and all. Okay, we have to look for. Okay, so why it is important to look for the wall whether it's plastered or not? So when actually I'll just share my experience. When I was doing PG, we used to go for the take cases in the field. Okay, we used to go to slums where to take the cases. When we go to there, so we used to see the houses where people just build the houses without much plastering and all. Just they just put the bricks, okay, and they build the wall. When they see the wall, there is no uh, plastering and all. There are so many crevices. Okay, so I was just taking the case. What happened? Suddenly, one rat ran through the house. I just asked, what is this account? So many rats are there. No, they are also living with us. We are also living with us. Okay, that is the answer I got. Okay, why it is important? And I asked whether what are you getting any bites and all? Yeah, she told yes, they're coming and they're biting and all. She is not taking any precaution for that also. And when I see for the crevices, what happens in crevices? If there's too much of in the wall, there's too much of crevices are there. There will be, if the rainy season, damp seasons and all. What will happen? Scorpions, then millipede, centipede, even in some which is very close to forest areas, and we may see for the snakes and all hiding there. Okay, so it will indirectly tells about the risk of the family in that scenario. Okay, so if the unplastered walls are there in the house, there is always risk for these uh, insects and these arthropods to lay there, means stay there. Then next one is roof, whether it is RCC or some cement used or sheets. We have to ask why it is important, because in olden movies and if you see huts, means there'll be water will be pouring when the rain comes, the water will be trickling down from the roof, and people has to wake up in the middle of the night, and they have to collect the water so that it will not dampen the floor and all. Okay, such things will happen. So that's why you have to ask all these things. So whatever we are asking in the history, not only in the history, everything has a relevance to the person's disease. Okay, so you have to keep in your mind always when you are asking any history, even for negative history also, you should know why we are asking this negative history. Okay, if the wall, everything is correct, then that house will be become pakka house. If the wall is not proper, if the floor is mud floor, roof is not proper, then it becomes kacha house. Some people may say semi kacha, semi pakka and all. There will be a little bit so much of confusion. Okay, for your level, just stick to pakka and kacha house. Okay, so when you entering the house, you can see number of living rooms. How many living rooms are in the place? Okay, in this living rooms, you have to explore the kitchen. Okay, you have to look for how many living rooms are there in the house. Okay, so next one is kitchen. Whether kitchen is separate or same in the living room they're using. If you go to in Bangalore slums and all, we have seen just in one room there will be around 8 to 7 people living in a house, and same, that is the same one room will be kitchen, one room, same room will be a bedroom, same room will be hall also, means living room also. Okay, that is a situation in some slums. Okay, so you have to look for it. Well, why it is important? So if it is, for imagine if the type of fuel is, you ask what is the type of fuel they're using, whether they're using LPG or they're using any firewood or they're using kerosene. For example, imagine the type of fuel is firewood and there is no separate kitchen, and imagine that in the same house there is a 2-year-old kid also. So what happens? There is always risk for the child to have any injuries related to fire, and also too much of smoke, indoor air pollution will be happening because of the firewood. So this will increase the risk to the child regarding the acute respiratory tract infections. Okay, those who are having firewood at home and there is no separate kitchen and there is no proper chimney and all, then these children under 5 children and also elderly, more than 60 years people are having more risk of getting the ARIs repeatedly. Okay, so children having ARIs 3 to 4 in a year, it is common. Okay, but they will have more if they're having no proper firewood. If there is firewood and also there is no proper chimney, then there is increased indoor air pollution. This will increase the chance for the sorry, chance for them to go for the ARI. And you have to ask for number of windows and size. Size you just can write approximately, and doors also. Why it is important to check whether there is a proper ventilation in the house also or not. Okay, so instead of we talking about only ventilation, I always try to tell about cross ventilation. Whenever we talk about cross ventilation, means the windows and doors should be always in the opposite direction. Okay, if it is there, then it is adequately ventilated. Okay, how much floor space should be ventilated? Means should be the windows. They say 1/10 of the floor space should be windows, and 1/20th floor space should be windows and doors combined. Okay, then only it is adequately ventilated. And cross ventilation means there should be opposite direction, there should be windows or the doors. Next, lighting. So what is light? Whether it is natural or artificial. So you have to ask whether they can use artificial light like candle, means tube lights and all. So whether it is adequate, means it's natural. Then adequate or what is adequate? When do you sit adequate lighting? If I go and sit in the middle of the room, okay, living room, and if I able to read a newspaper without much difficulty, then it is that is mean adequate lighting is present. I will repeat again. If I go and sit in the middle of the room in a living room, and if I'm able to read the newspaper without any difficulty, then it becomes adequate lighting. And if I'm using natural light, if without any much difficulty, then it becomes adequately light. Okay. Next, then toilet, whether they're going for any open air defecation, okay, or then sanitary toilet is whether it's an Indian toilet or Western toilet, you can write. Okay, some in slums and all there will be initially in olden places and all there will be complex of small rooms, 1 or 2 rooms. Okay, for 2-3 also there used to be only one latrine. Okay, so in that time they may have to use the sanitary they have to use the sharing. And even in some slums in Bangalore, still people go for the BBMP has constructed some toilets, so where daily they'll go there and come back. Okay, so these and all will affect the person's health in a way. For example, if there may not many proper sanitation and all, this may lead to diarrheal disease and other things. Okay, next, waste collection and disposal. So whether how they're collecting the waste. Okay, how they're collecting the waste, whether regularly collected or irregularly collected, or safely disposed or indiscriminate throwing. So indiscriminate throwing means some you might have seen in nowadays seeing people they think, okay, it's not my house corner, okay, let me throw the waste there. Okay, this is what's happening. So people nowadays in Bangalore and all, if they don't segregate dry waste and wet waste, they may not collect it. Okay, correct. So those things and all we have to write whether their proper collection is happening or not. So if some people may be having their own compost pit at their house, if they're having any methods to do the waste disposal like compost pit and all, so you can write about it if it is there. And surroundings, whether it is clean or not, whether hygienic or not, you can mention. Then water supply, what is the source, whether they're getting the pipe water supply or bore well or open well or some way, or they're getting from the corporation or getting from the municipality, you can write it. And how they're storing it, before consuming, whether they're doing any other method of household purification like boiling, filtration, chlorination, or then nowadays we're having filters, no, aquaguard filters, UV filters and all, so you can write about it. So are there any domestic animals are there, you can write. For example, if they're having cows and all, you can write whether shed is there or not. Then if they're having any domestic pets like uh, dogs, cats and all, you can write. Next one is nuisance vectors, like what you call nuisance vectors means animal like mosquitoes, housefly, sandflies, then ticks, mites, anything are there, you can write about it. Okay, then after collecting all these details, you can write about the remark. Okay, you can write about the remark, whether their overall their environmental history, whether it is good or bad, poor, average, you can write about it. So here I want to tell one more thing regarding the kitchen. So you just you have to remember that kitchen is one of the important aspect of the, means important part of the family or for that house. So whatever they cook in the kitchen, we will be consuming. What we consume will become part of us. Correct. So whatever they do properly, whatever they do in the kitchen will become part of us. Correct. So you should always give a little bit importance for the kitchen. So here you can talk about, you can add a sub headings like how they're storing the cooked food, whether they're cooking, how they're storing cooked food and how they're storing the raw food. Is there any refrigeration at their home? If they're not, if there is no refrigeration, how they're storing the food? If they're having, if they're not, how many times they're cooking in a day? Frequency of cooking. Okay, you can ask those questions. And if they're how they're storing the raw food, for example, they brought the vegetables and all, how they're storing the raw vegetables. Okay, are they using refrigerator or they're using some other method of storing? If they're using if they're, how frequently they're going and bringing the vegetables. Okay, those questions you can ask in the kitchen part. And also one important point you can look for is in a kitchen is whether the platform is there for the cooking platform. Cooking platform is very important. So why? Because this cooking platform will prevent the um, um, fire injuries, especially for the mother and the children, under 5 children. Just imagine in olden there is no proper cooking platform, but there's no cooking platform. So mother has to cook the food at the ground level. Okay, so she has cooked something and she has gone out to buy something or to see something. Imagine a child is there in that house, let's say 2-year-old, 3-year-old kid may come for in search of the mother. So the mother has made sambar. The child is, if the mother is not, the child may go and put the hand in the sambar, or it may make the vessel to fall on the child. Okay, so it will increase the burn injuries. Okay, and for the same matter, if the mother is cooking by sitting at the ground level, for example, if any fire accident happens immediately, the reaction time which it takes, she has to get up and then she has to run. If she's cooking on the platform while she'll be standing, okay, this will decrease the chance of fire injuries. Okay, that's the main purpose why kitchen platforms, cooking platforms have come into the kitchens, not for the to show our luxuries. Okay, so the main purpose of the kitchen platforms are for, these are the two reasons what I told. Okay, so if you're having any doubts still history taking, we can discuss, then we'll go ahead with the physical examination. Any doubts? Okay, if no doubts, we'll just go to history, means continue with the. Okay, so if you just see here, so we're having the general physical examination. So here I'm not going in detail about general physical examination. So you all know that. So we have to write about their level of consciousness and orientation, built nutrition status. Then you can write about their whether it is whether pencil, pickle, whatever you have the mnemonics you can write. Then you have to write about vitals like pulse, BP, then respiratory rate, temperature, and if you're dealing with a child who is less than 5 years, you have to deal with the, you have to write about the anthropometry like height, weight. Then if you're dealing with a child less than 1 year, you can write about length. Then you have to write a birth weight, anthropometric measurements, then chest circumference, head circumference, then arm circumference. Okay, those things you can write for a child less than 2 year and pediatric cases. And if you're dealing with a NCD case, not only NCD case, any adults also, you have to talk about the BMI. Usually we don't write the BMI for the pediatric cases. Okay, so pediatric cases we don't write BMI, and also we don't write BMI for the ANC and PMC cases. That is antenatal, means pregnant mother and postnatal mother. Okay, don't write BMI for these two, but write the weight, write the weight of the mother during the immediately when the pregnancy has been found out, and what is the present weight and how much weight she has gained over a period of time. Okay, those things you have to write for the ANC case and PNC case. In PNC case, how much weight she has lost after the pregnancy and how much is the present weight. Okay, you have to write all those things. Okay, next one is, so you write all those things, then you go for the systemic examination. So whichever system you're dealing with, like respiratory system or cardiovascular system, per abdomen or central nervous system, you write. For example, you're dealing with the respiratory system. Respiratory system, you write in detail, like inspection, palpation, auscultation, and percussion. Sorry, percussion and auscultation, you write everything in detail. Then if you're dealing with cardiovascular, same thing you write. Then if it is whichever not, if you find out any important findings in the other systems, you write important points about them. Then you finish the examination. Based on your clinical history and epidemiological history, do you have any, you can talk about what are the differential diagnoses you're having. You can think about it. You can write a differential diagnosis, what your clinical diagnosis. For example, you're dealing with pulmonary tuberculosis. You can write this patient is a pulmonary tuberculosis patient. Okay, then you can write this is a pulmonary tuberculosis case patient, whether it is having contact or fresh case or reactivated case, relapse case or new case, whether it has been linked with program or not. Okay, you can write all those things. Just a minute. Huh? Yeah. Okay, so if there is a deficit of 200 to, okay, so just a minute, before I go to the other part, I just, somebody has asked, if there is a deficit of 200 to 300 calories, what all foods have to be considered other than fruits? See, it's always diet is should be individually customized. Okay, should be customized according to individual level. For example, you think that patient is taking calories correct, but there is decreased amount of proteins, then you have to go for the food which is having more protein. Okay, for example, if the patient is having anemia, okay, maybe mild anemia, then we have to go for the food which are rich in iron, so that people will have they can consume more iron rich food. Okay, so it's always depends on the, for example, if there are 200 300 kilocalories deficit, definitely if they're non-vegetarians, or you can ask for them to go for consuming daily 1 egg or 2 eggs. Okay, then if they're not vegetarians, you can ask for them to go for the soya or whole pulses instead of going for only broken pulses. They can go for the whole pulses. Okay, whole pulse will have more protein compared to the. Okay, so it depends on the this one. If they're depend on the staple diet. What is staple? Staple diet means what is commonly consumed in the family. Most of the South Indian families will consume staple diet is rice. Okay, rice. Some part will be in Karnataka will be having along with the rice, ragi and jawar. Okay, so you can, based on their thing, you can modify their diet. Okay, and diet modification, it's always important, especially if they're having any non-communicable disease. Okay, for that any matter, if you are dealing with diet modification, always go for the patient's or person's preferences. Okay, like for example, I can say you have to eat daily oats. Okay, you should have to look for the person's ability to whether they can buy oats or not. Okay, so what is locally available, what is locally easily available, then only, and what is easy to for the patient to eat also. So what happens sometimes, we say you have to cut short, you have to decrease this, you have to decrease the sweet, you have to decrease the rice, you have to increase the chapati. We will tell you have to increase the consumption of the ragi and all. Okay, so if it is locally available, you tell that. Sometimes if it is not locally available, for example, you go for the North India and all, there is ragi will be less available. If you tell the same thing for them, it is not so easy for them to accept it. Okay, so you have to see for the cultural background to advise the, and what is locally available, then only you can give them the dietary modification. Okay, then you ask for, so based on your history and examination, you arrive at some clinical diagnosis and you write the clinical diagnosis. You can ask what are the investigation you wanted to do for the confirmation. Okay, you write the what investigation you want to do. Then, for example, you have the results, lab results and all. Based on the results and clinical means history and examination, you can write your final diagnosis. Okay, you can write your final diagnosis. So when you're writing the final diagnosis, here I always okay, you can do one thing. Final diagnosis you can write after the KAP and social element factors. Okay, so you can next, what is KAP? That is knowledge, attitude and practice. So about the disease. So what is knowledge? I always tell this simple example to understand. Okay, so if you see now in this COVID time, the main aim of any healthcare system, the main aim of the healthcare system is to make people aware about the disease and have very good practice to prevent the disease occurrence. That is the main aim of the healthcare system. Okay, the main aim of the healthcare system is not only to treat the patient. The main aim of the healthcare system is to make sure that people have knowledge about the disease and they can take care better themselves, not always by the doctors or healthcare system. Okay, that's the main aim. So if you see in this COVID time, we all know that. So if you ask anybody, even if you ask small kids also, they tell about wearing mask, doing hand washing, using sanitizers, and social distancing or physical distancing, whatever. Okay, but if you see 2 months back, everybody was very much adhering to that. As the day progresses, as the unlockdown has been happened, nowadays people are not using very means they're using everything. They're using the mask, they're doing hand washing, they're using sanitizer, but they're not doing it proper way. If you go to some places now, if you go to a grocery shop or if you go to buy something and all, people will be wearing mask, but where not be on the proper method. Okay, they know the knowledge, they have the knowledge of if you're wearing mask, it prevent the disease. But practice, what practice they're doing practice, correct practice or wrong practice. They may be, most of the people are doing wrong practice. Okay, our main aim is to convert the proper correct knowledge to correct practice. Okay, for that we have to be keep on giving the health education. This KAP will help us to give the health education component in the management. Okay, simple example I'll give. So knowledge. So what is the knowledge? So in this scenario, like take COVID only. In this scenario, wearing mask correctly prevents the transmission or decrease the chance of getting the disease. Okay, that is the knowledge. So what is the attitude? Whether I am accepting that is truth or not. So you might have heard in news and all, there is a campaign going in US and all, anti-mask campaigns and all. What is their attitude? That is a negative attitude towards the mask. Correct. So even though they know that knowledge that wearing mask may prevent the disease, but their attitude is not accepting that knowledge. Okay, they are doing anti-mask campaigns and all. Okay, so same way, so people will be knowing that wearing mask will prevent the transmission. Okay, but we are accepting it and we are using it. Practice, we are doing the having good attitude also. When it comes to practice, where are we practicing correctly or not? Yes, we have to look for that. So if you see people, they will be wearing the mask, below the mouth, below the nose. Some people will be just hanging the one side, their mask will be hanging on one side of the on one ear, and some people will be wearing the mask to the chin and all. Okay, these are all wrong practices. So okay, so we have to look for the knowledge and attitude and practice of the patient for that particular disease. For example, if you deal with the diabetes, a diabetes patient is there, whether he knows about diabetes, like how it happens, what are the major causative factors for the diabetes, what is the importance of taking drugs continuously, what are the complications if I don't take the tablets or drugs. Okay, and what is the importance of doing exercise and diet modification, whether at least few things, whether he knows or not, we have to assess. Okay, then about his attitude, whether he's practicing, whether he wanted to do it or not, whether he's willing to accept those things or not. Then practice, whether he's doing it or not. Okay, having knowledge is not always 100% sure that patient will practice it. Okay, for that any matter, humans are very complex. Okay, I will be so many, all of us, most of us know that knowledge, daily walking for 20 minutes to 40 minutes is good for health. How many of us will be doing? And we teach the same thing to the patients also, but ourselves will not be doing, correct? So our main aim should be to convert correct knowledge to correct practice, our main aim for healthcare system. Okay, so that we can prevent so many diseases by that. Okay, so you have to ask, for example, in diabetes means you ask all those things, knowledge and practice. Then based on his knowledge, for example, a doctor has become diabetic, so there no need to talk about knowledge part much. So you can talk much about, for example, there may be a little bit lazy, or little maybe because of their health, because of their busy schedule. Okay, they may not be able to give much importance for their life. Okay, their health. So you have to you have to make them realize that health is important for them also, not only for the patient, for them also. For example, the same diabetic patient who has come, but is not a, is just a, say, who was past 10th, is done only SSLC. He may be not knowing much about diabetes. Then my health education component should be mainly targeting about creating awareness about diabetes. Then over a period of time, we may make him to do the correct practice also. Okay, so it will help us to plan our health education component. Okay, next one is social and environmental factors responsible for addiction. So whatever factors we have discussed in environmental factors, like for example, we're talking about environment. For some people will be having low socioeconomic status, will be having TB. Some people will be those who are having affluent people. They will not doing any exercise at all, so they will be having diabetes. So they will be, so those are the factors which are affecting for that particular disease. You can write it there. Okay, then based on the KAP, based on the social factors and environmental factors and your clinical history and all, you can write a final diagnosis. Like for example, you say a pregnant mother is there who is anemic. Okay, you can write a mother is how many months of pregnancy. You can write like this month of pregnant mother. Mother has come for the safe confinement, or with anemia, mild anemia, moderate anemia, severe anemia. And what are the factors which are affecting? For example, she comes from low socioeconomic status. This is affecting her, and she is having less calorie intake based on nutrition history, diet history. You can mention that. So this is contributing for her to become the anemic. Okay, you can write all those things in your. Okay, and if at all, if we add one more level, one more point, that is what level of prevention failures occurred. Okay, for example, we know that there are 4 levels of prevention. That is primordial, primary, secondary, and tertiary. So what is primordial level of prevention? The primordial level of prevention is one of the ideal method of prevention. Okay, in primordial level of prevention, there won't be any risk factors at all. There is no risk factor at all for the particular disease. So at that point of time only, you are giving the intervention. That is primordial level of prevention. If the person is having some risk factor, okay, risk factor is not converting into disease. So before risk factor converting into disease, you are applying some intervention. That is primary level of prevention. Okay, so a disease has occurred, risk factor is converted into disease. Okay, you are preventing a disease converting into some complications. At that point of time, you're giving the some intervention that is called as secondary level of treatment, second level of prevention. Tertiary level of prevention, even though tertiary level of prevention means complications have occurred or disease has gone a little bit way ahead about what we are thought. Okay, in that point, we are making sure that person is able to live whatever he having now. Okay, so like rehabilitation and all, that is tertiary level of prevention. So we are having 4 levels of prevention, that is primordial, primary, secondary, and tertiary. So for example, you are dealing with a patient who has come for the tuberculosis. It means patient as the risk factor has come to as diagnosed with TB, means risk factors converted into disease. So what level of prevention failures occurred here? It is primary level of prevention failures has occurred. Okay, so you can write along with that. So in this case, primary level of prevention failures occurred. So this is the reason for the patient. You can write like that. Okay. Then along with the levels of prevention, there is one more thing called as modes of intervention. Okay. So the other, what are the modes of intervention for these levels of prevention is, we are having health promotion and specific protection. This health promotion and specific protection are part of primordial and primary level of prevention. Health uh, health promotion. Health promotion means telling the people to do good practice, like having good balanced diet, doing everyday exercise, and not having any bad habits like smoking, consuming alcohol, or going for taking for the drugs and all. So these are all health promotion. Okay. Next one is specific protection. Specific protection, one of the best examples for the specific protection is giving immunizations or vaccines. Okay. You, for the particular specific disease, you are giving some protection, that is specific protection. Okay. The example, best example for that is your immunization or vaccines. So next one is early diagnosis and treatment. This early diagnosis and treatment comes in part of the secondary level of prevention. Okay. The main aim is diagnose as early as possible so that disease will not convert into complication. Okay. So diagnose as early as possible and treat the patient correctly. Okay. That is the secondary level of prevention. That is early diagnosis and treatment. That is the modes of intervention for the second level of prevention. Next one is tertiary level of prevention. In tertiary level of prevention, we are having the mode of intervention: disability limitation and rehabilitation. You limit a disability, and if at all disabilities happen, you rehabilitate them. So rehabilitation means whatever person is having, for example, a person has got accident and he lost his leg. Okay. So with whatever is having, with that leg only, you can, so disability limitation means you giving him a prosthetic leg, that is disability limitation. So with the prosthetic leg, how can he survive? So for example, imagine he was a security officer. Okay, where security person, where he has to stand for hours. Okay, with amputated leg, he cannot stand now. So he can do some rehabilitation so that he can do, like instead of doing security work, we can teach him other work so that he can live his life dignified. That is called as rehabilitation. Okay, these are the important points regarding the levels of prevention and modes of intervention. Next one is management. So in management, we discuss in terms of three levels. One is individual level, other one is family level, and community level. So individual level, family level, and community level. Okay. So in individual level, what are things we have to talk? In individual level, there will be mainly two important things. First thing is, for any person who has come with a disease, you have to treat the patient first. Here, if you keep on telling that you should have done, you should do this, you should do that, instead of treating the patient, for example, patient come with fever, instead of giving paracetamol, if you keep on telling that you should have done that, you should have done this to prevent the occurring of disease, patient will not feel happy. Okay, first you treat the patient. Okay, first thing is treat the patient with the particular, for what disease has come, the proper, like antibiotics, whatever is required, you treat it. Okay. Next thing is, it should not be repeated again. This disease should not be repeated, should not come again, or should not spread to others. So here you talk about the health education component. So for example, if that disease is tuberculosis, so to talk about is cough etiquette, is diet, how to improve his immunity, and what is the importance of compliance to the drugs, what is the importance of compliance to the doing sputum examinations, and what is the importance of doing proper cough etiquette. Okay, all those things you can talk. Okay, next one is, and under this, any things, for example, diet history, for example, diet modification, if you're talking about diabetes and hypertension, any diet modification you're talking. Okay, importance you have to tell to the patient. So whatever level, whatever you told to the individual level, like treatment part, also for health education component, repeat the same thing to the family level. Why? Because we should always include the family into the treatment part. So what we usually do, we always neglect the family role in the treatment part. This is very, very wrong. We always include the family into the treatment part, because imagine a patient who is a diabetic patient who has come to you alone, or he has come, you are only telling him to modify the food. Okay, imagine that person is a little bit lazy person, or he loves sweet much. Will he tell when he goes back to the home, doctor has told that not to have much sweets, or not have rice? He may not tell, because he loves rice and he may love sweets. Okay, that's why always try to include the family. So if you include the family, so what will happen, they also aware about the this diet modifications. So they will take the initiative. If even the patient is not taking the initiation, they will take the initiation, and they will try to modify the uh, diet. And also same way in comes to pregnancy. If you tell the all the you may tell the mother to take the iron rich food, consume, take rest, bed rest and all. Every day afternoon you have to take 2 hours of sleep and all, you tell. But you're not including the family members in that for while telling those things. What will happen? Imagine daughter-in-law has gone back home. She may tells that doctor has told like this, and if she takes rest. I'm not telling every houses. Some people may say, see, this lady is taking simply putting this as a reason to take the rest, to avoid the work, they may say. So always try to include the family. And if you don't tell the family members what iron rich food should be given to the pregnant mother, so what will happen? So they may not change about diet much. They will continue with what they're cooking for ages. Okay, so you have to include the family so that they will modify the diet. Okay, when it comes to community level, so community level means we have to deal with the, if you are a medical officer at a PHC, so what are the national programs will be available for this patient for this disease? Okay, if you're talking about TB, we can talk about RNTCP. Now it is called any in National Tuberculosis Eradication Program. Then next, you can talk about, if you're talking about diabetes, you can talk about NPCDs program. If you're talking about pregnancy, you can talk about NHM, RMSH plus A, JSY, JSSK. Then you can talk about RBSK. Okay, IMNCI, ICDS. So many things are there. So what are the programs available for that particular disease or particular condition at the PHC level? You have to talk in the community level. For example, if your patient is, if the mother is, pregnant mother has come, so you have to talk about what are the benefits under JSY scheme is there for that mother. Okay, and in some states they're having different, some new along with the central government scheme, they're having other schemes also. Central government, state government also contributing something, some like Tayi Bhagya scheme in Karnataka. And if the so many schemes are there. Okay, so you can talk about those schemes. Okay, this is about the community level. These are management. So apart from this is for general thing. If at all, if you're having any assessing any doubts till now, before going to other section, just another 5 minutes I may take. If you're having any doubts, you can ask. Okay. I hope no doubts. We'll continue to the next one. If you are dealing with any underby child in the clinical social case, then you have to write about, as I explained, you have to write anthropometry in detail: weight, height, mid-arm circumference, head circumference, chest circumference, skin fold thickness, and then you have to do the assessment of the nutrition. Okay, like we say 8 to 2 examination, no? In pediatrics, you do 8 to 2 examination of the child. Okay, like skin, hair, face, eyes, lips, tongue. So whatever is there, you can look for it. Okay, so you can, if you're having any, if they're having any other abnormalities also, you can write about it in the 8 to 2 examination of the children. When it comes to your PNC or ANC cases, you have to write some important points regarding the antenatal care components. Like you have to write in detail about the regarding the first trimester, second trimester, third trimester, and whether they're done registration of the ANC, how many antenatal visits have been done, what antenatal diet they're taking, whether they're doing medical examination in the private setup or government setup, are they doing any examination in the, I mean, they're going for the whether they're done by Anganwadi worker or Asha worker, okay, whether it is already delivered or still she is having this one, okay, all those things you have to write regarding immunization status of the mother, mothercraft education. What is mothercraft education means how to start breastfeeding the baby, and how to start the weaning, and uh, how to modify diet for herself, okay, and advice on drugs and radiation, family planning advice. Family planning advice is very, very important during the pregnancy, along with the immunization, okay, and postnatal care components like where delivery has happened, whether the child is normal, whether the child is born in institution delivery or home delivery, whether any complication happened, whether any child is having any low birth weight or normal weight of the baby, so any complication happened, those things you have to tell to the in PNC case. So PNC case will never be complete without the exemption of the child. Okay, so you have to talk about the Apgar score. You talk about the child has been born mature, premature, post-mature, term, like term, post-term, preterm, whatever is there, you can write, and risk assessment of the child, and you have to do the 822 exemption of the child here. If you don't do the 822 exemption of child in PNC case, your PNC case will not be complete. So this is about the this is general Proforma. As I told, you have to do some modification with respect to the like ANC or PNC cases, and also for the under 5 children. In children you're talking, you might talk about the birth history. If it is less than 1 year, you have to write a little bit detail about the birth history and immunization history and all. If you're dealing with a child who is 5 years and all, then you can write about only birth history in 2-3 sentences. And if any uneventful events have happened, then you have to point out those things. Okay, if you have any doubts, you can discuss now. Otherwise, Shravan. Yeah.
Sir, we're just looking to YouTube, sir, if there are any doubts.
I'm not able to. Your voice is breaking.
So I have posted a doubt from YouTube, sir.
YouTube, huh?
Yes, sir. Now it's visible in the chat, sir.
Yeah. Should family planning advice given to all mothers or mothers having more than 3 children? Yeah. Family planning should be given to all the pregnant mothers. Okay. Why? Because we always tell pregnancy for example, the mother has become first time pregnant. Okay. So we always tell there should be minimum of 3 years gap between first pregnancy and second pregnancy. Okay. So there are different types of family planning methods, right? So temporary methods, permanent method, and all. If the mother is having more than 2 children, then you can advise for the permanent method, because we in India we follow 2-child norm. So if the mother is having 2 children, definitely you can ask them to go for the any method of permanent methods like tubectomy or vasectomy. Okay, and if they're having only she's pregnant now for the first child, immediately after delivery, you can ask her to go for the any other method of temporary method like copper tea or progesterone only pills. Okay, so which is the ideal method of contraception of choice for newly married couple? Anyone can answer. So some questions related to important points in the family planning, what can ask in your social discussions are cafeteria approach, OC pills for newly married couple. Yes, newly married couples is OC pills is the best method. For mother who is lactating mother, ideal choice is progesterone only pills. If mother is having 2 children, the ideal method of choice is vasectomy or permanent method. Okay, we'll discuss why vasectomy is important, why it is best ideal method compared to tubectomy, because vasectomy is very easily done, can be done easily done. Okay, very less complication compared to the tubectomy, and less and easily. If the patient has undergone vasectomy in the morning, immediately after 2 hours he can go for work. That is no scalpel vasectomy. That is the advantage. But only one disadvantage with the vasectomy is you should always tell the person to use any other method of contraception for at least another 2 to 3 months, because what happens after doing vasectomy also, there will be some sperms will be lodged in the epididymis, so it may once it may ejaculate into the semen, it may cause pregnancy also. So for at least for 2 to 3 months, they have to use any other method of contraception. Okay, but since most of the communities are patriarchal society, they always believe in means we always think that family planning is a matter of women. It's not a matter of males. It's not like that. Family planning is matter of couple. Okay, it's both have to take the responsibility. Both male and female has to take the responsibility. Okay, so these are the things. Okay, so important questions what they can ask in family planning. I'm just typing it. Cafeteria approach. One more is who is the ideal candidate for IUCD, Kaparti. Who is ideal candidate for Kaparti? Who is the ideal candidate for Kaparti? They may ask these questions, and they will ask what is today. What is today? So you can find out those things today in family planning. Okay. In ANC, yes, correct. Yes, no, not moderate projection injection. You can read it's centrochroman. Okay, any other questions? Ideal candidate property. Who is ideal candidate property? You can read, and you can read about family planning methods. And those who are reading for ANC and PNC should read about JSY, JSSK, RBSK, RMNCH plus A, then ICDS and RBSK. What is RBSK? Then Apgar score. Those who are reading for the PNC, Apgar score. Brief diet recommendation for DM. So a brief diet recommendation. Okay. So see, for example, a patient has come who's diabetic. First, you look for his diabetics BMI. Okay. If the BMI is less than, if it is normal, you change the diet. If they're consuming more of carbohydrate rich diet, for example, if they're consuming more of rice rich, or more of sugar carbohydrate rich food, then you try to shift to the protein rich food like wheat, which is having more fibrous food. If they're consuming, we cannot say this is the ideal method. Okay, you have to customize the according to the patient's need. For example, just for the sake I'm telling, for example, if they're taking there are one important thing we always tell in the diabetic patient: there should not be no fasting or should be no feasting. Means they should not fast or they should not feast also. For example, what is the common tendency? Hey, today family function is there, let me have sweets and all. Okay, tomorrow I'm going for the blood checkup. Today let me not eat any rice. For 2 3 days they will not eat rice. They will not eat anything much, so that the blood levels will come down, so that they feel doctor may think that the blood levels are normal for the last 2 to 3 months. Okay, but These things should not be done. Okay. Next one is if they're, you have to check their BMI. If the BMI is normal, continue with the required calories, but check for the whether they're taking the adequate protein or not. If they're not taking the adequate protein, you try to shift from the rice based food to little bit wheat based and ragi based food. In Karnataka, you can go for ragi, jawar and all, jawar rotis, ragi mudde and all, you can go. Then if at all, if they are consuming very less vegetables, okay, you can add more vegetables, because if the fiber is more in the food, if the fiber is more in the food, there will be less variations in the sugar levels in the diabetic patient. Okay, because the fibrous food is there, means body has to struggle a lot to take the sugar to the glucose to the blood. Okay, whereas if you give simple sugars like glucose, sucrose, and even for that matter maida and all, what happens, they have very less fiber. Directly it will shoot the sugar levels in the blood for diabetic patient. So that's why they will have episodes of hypoglycemia and hyperglycemia. So to decrease this fluctuations, what we advise, you advise them to go for the fiber rich food. Okay, for that they can increase the green leaf vegetables content in the this one. And instead of going for the we always say they can go for, instead of having only 3 times in a day food, like morning, breakfast, lunch and dinner, we always tend to go for the 4 or 4 times frequent feeding. Okay, frequent feeding, like 4 or 5 times. So what we can do, we can ask them to divide the, for example, number of, for just for example I'm telling, if their required kilocalories 2000 kilocalories, okay, you divide that into 5 parts. Okay, 5 parts. So 20% you give in the morning, then morning snack, then 20% in the evening, afternoon lunch, 20% of the kilocalories in the evening snack, 20% in the dinner of the kilocalories. Okay, so you put it here as the increase the quantity of the green leaf vegetables along with the protein. And if the patient is having any kidney complications, if you overshoot the protein levels, it will be dangerous to the kidney also. Okay, that also you have to keep in your mind whenever you prescribing the diet. Especially you should look for the kidney status also. If they're having any kidney complications, protein level should not be not excess than the what is required. Okay, so you can ask them to go for the green leaf vegetables. Like in green leaf vegetables also, there are there is one general rule to easy to remember. Okay, whatever grows below the ground, especially vegetables, whatever grows below the ground should be avoided. Okay, like potato, tapioca, then carrot. Okay, but except you can accept uh, radish, onions, ginger, and even what is that, garlic can be taken even at normal quantity. Okay, then when it comes to other vegetables, like you can ask them to eat any other available vegetables, but they should not eat much of these roots and tubers. Okay, then regarding the fruits, I will not tell now. So you can go and check for what is glycemic index of the foods, and what foods glycemic index of the food, what foods they have to take based on the what fruits they have to take based on the glycemic index. Okay, read about glycemic index and you can discuss. And you can always tell the patient, diabetic patient, to they can have the fruits which are having less carbohydrates. Okay, so we always tell this one rule, general rule, they'll say they should not have much of fruits which are having more ripe. Okay, they can have which is a little bit unripe food, because when it becomes ripe means there is too much of conversion of complex sugar to simple sugars. Why fruits taste sweet? Because of the fructose. Okay, that's why before it becomes ripe, in between unripe, little bit unripe will be there, that if they'll be having less simple sugars compared to the completely ripe sugars. Okay, So there are some things you have to read like regarding glycemic index of the food, regarding diabetic modifications. Then based on that you can divide. And important thing is you have to look for the BMI. If the BMI is too much, already they are obese and all, definitely you have to decrease their sugar levels, means weight also along with the control of the sugar. So you have to monitor their diet properly. Okay. Any doubts now? If you're having any doubts, you can ask.
Any other doubts, guys?
Okay. Otherwise, we can finish. No?
Yes.
If they want, I can share this one.
Sir, could you please share the PPT? We'll share it in a group, sir.
Okay, I will mail it. I will. Okay, this is not PPT. This is Word doc. I will share it in Word doc.
Okay, sir. So you can share it to my number, sir. Can
Okay,
I
guys.
can I type the number, sir?
You can type.
Yes, sir. This is my.
Yeah. Okay, I got it.
So that's all with the doubts, I think so, sir.